My name is Francois Fent. I'm a professor in the Department of Medicine at the University of Witwatersrand. I'm also Deputy Director of the Reproductive Health and HIV Institute at WITS, RHI. I was asked to talk about things which I find controversial, which I think are important for clinicians to deal with, and one of the ones I think which is an area which I always reflect on and I find really difficult is why is HIV so bad in sub-Saharan Africa? Why specifically in South Africa, and that little circle that you draw around from Zambia down around all the countries in the area, why is it so severe there? Is there something that about our behaviors, our sexual behaviors in particular, which makes it so why do we have situations where almost 1 in 5 adult South Africans have HIV? You go to Europe, you go to South America, you go to Asia, it's a tiny minority of the population. And a lot of people have put forward for 30 years that there's something about our sexual behavior that's different. I find this really difficult to understand, and the reason I find it difficult to understand is I don't think certainly the behavioral data that we have suggests that there's sexual behaviors within sub-Saharan Africa, and particularly in South Africa and the surroundings, which are that much different from Europe and America. If you look at the data my institute has done several studies, including ones looking at adolescents' sexual behaviors. Our adolescents lose their virginity later, they have fewer sexual partners, they're more likely to use condoms when they are having sex. All the so-called good behaviors, on the face of it, look to me as if we should actually have a lower rate of HIV in our communities than they have in America and Europe. However, we have a situation where a young KwaZulu-Natal black woman at the age of 19 has approximately 3,000-fold greater chance of having HIV than her counterpart in London or in Adelaide or even in Bangkok. So what is that about? And I think that we've been very bad about explaining that to people. And the reason that's important is that people keep talking about behavior change, and they keep talking about wanting people to behave better. There's this, and it's coupled with this strange idea that somehow the new generation is less moral than previous generations. And I think as scientists we've done the world a disservice by trying to actually collude with this, is that we just don't know. What we do know is that the sexual transmission event of HIV in our region is far, far, far more efficient and effective than it is in these other parts of the world. And that there may actually be a situation where we turn around and say that it seems like a good idea. It's definitely sexually transmitted, it definitely seems to be the more sexual partners you have, the greater your risk. But there may come a time where we simply turn around and say, we're going to have to find something else that's actually going to stop HIV. And that's where I think my frustration with many of the people who talk about behavior change seems to be that they think this is what's going to do the trick. I think we're going to need far, far, far more than that's what's in there. And I think we're going to need the vaccine, we need pre-exposure prophylaxis, we're going to need better condoms, we're going to need better understandings of the sexual networks and how to intervene with them. But casual, common sense ideas about how we're going to stop HIV based on behavior change, and particularly around evidence stuff which is not evidence-based, which actually has been found to be wrong, things like concurrency. Even things like sugar daddies have been found to be, the data has not supported the fact that this is what's driving the epidemic. So I guess what I'm interested to see is like a coherent HIV prevention response that doesn't rely on common sense intuition, which is usually wrong, that seems to be driving most of these behavior change programs. I think it should be simple. I think it should be reduce your number of or just understand that the number of sexual partners correlates with HIV risk, use condoms, and get yourself tested, and leave it at that, and stop with these convoluted behavior change programs which are, as far as I'm concerned, just a waste of money, and start looking for more interesting and more innovative ways of implementing some of the biological interventions we have around treatments, prevention, and pre-exposure prophylaxis.